All right. We're good, Kevin.
Okay. Good morning, everybody. I want to welcome you to the 5th 2022 meeting of the City of Charleston's Health and Wellness Advisory Committee. As we felt when we left, for those that walked out this morning, felt there's a breeze, a little chill in the air this morning. Fall's here among us, and starting to see some Halloween decorations go up. And I was in the Home Depot yesterday, and they've got their Christmas tree out. So it's that time of year, exciting time for a lot of us. And I want to thank you for taking the time to join us this morning and be part of our committee meeting this morning. I know all of you's time is very, very valuable, and we'll try to be as efficient as we can with this, but we really appreciate you being here. I think Paul sent out the minutes from our September 7th meeting on Monday. And I'd like to make a motion that we approve those minutes. Can I get a second?
Second.
Okay, all in favor of approving those minutes, please say aye. Aye.
Aye.
Opposed? Okay, the minutes pass. So here real quick, I lost my screen for a second. Bear with me just a second. I apologize. Okay, and we are very, very fortunate today to have LaShonda Morgan with us. She's the Health Committee Chair for the National Council of Negro Women Bethune-Leonard section. She's project director with Breathe Easy Tri-County, and she's a community health worker researcher, the Center for Community Health Alignment. And she's also going to help me by introducing Dr. Phil Gardner, I believe, as well. But she's going to talk to us about the toll of tobacco on Charleston. So LaShonda, if you would, I'm going to hand it over to you now.
All right, thank you. Paul, could I get those slides?
Just a second. I am.
Okay.
You can go ahead and do your short intro, and I'll get it up there for you in just a second.
All right. Well, my name is Dr. LaShonda Morgan. I am the Health Committee Chair for the National Council of Negro Women Bethune-Leonard section and the project director of Breathe Easy Tri-County. And I am joined here this morning by Dr. Philip Gardner from the African American Tobacco Control Leadership Council. And today we're going to talk to you about the toll of tobacco in the city of Charleston. Thank you. All right. Next slide, please.
Did it turn over?
Yes.
Okay.
We can go to the next slide.
Tell me where you want to go.
To the slide number 2.
Okay. I'm going to go back out and come back in.
Yeah, I was going to say, Paul, start your PowerPoint presentation, and then when you share screen, select the actual the live presentation and not PowerPoint.
Okay. I'll do that, and then we will be ready in just a second.
Okay.
LaShonda, just talk a little bit more about your group, and I'm working on my end real quick.
Okay. So we are Breathe Easy Tri-County. We are a subset of the National Council of Negro Women. We've been doing a lot of work with the Center for Black Health and Equity and many other partners, but we were tasked with starting a multicultural, multi-ethnic coalition. Oh, there we are. If we could go to the next slide, that would be great. Yes, there we are. Our mission is to prevent the use of commercial tobacco through advocacy change, education, and community mobilization to benefit the health of the community. More specifically, what we've been doing in the Charleston area is we've been educating the community about the health implications around menthol. So the federal government banned flavors, tobacco flavors, because it was enticing a lot of youth. Like youth are vaping and using lots of tobacco products at an alarming rate. And so all the flavors were banned except menthol, and menthol is the flavor of choice for African Americans. About 90% of African Americans that use tobacco use mentholated products, and it really causes problems. Well, everyone knows that smoking causes health problems, but for those that want to quit, it makes it much harder to quit because of the cooling sensations you feel and other things when people are using menthol. And so we're really trying to educate the community about that. Next slide, please. So these are some of the partners we have been working with. We have local partners like the Smoke Free Low Country, who's done a lot of tobacco work in the Charleston area, Smoke Free SC, DHEC, and then we have a lot of national partners like the AATCLC is with me today. We have different NAACP chapters, lots of national partners, and then we are also supported by Healthy Tri-County here in the Charleston area. So why are we here? We are here to bring attention to the health implications and social justice issues around the predatory marketing practices of the tobacco industry in Charleston. We're also here to highlight, educate, and engage decision makers to understand the inequities that tobacco contributes to and gather support for an equity-centered policy to address tobacco disparities. Next slide, please. So predatory marketing happens in Charleston. It also happens nationally, but concerns around tobacco and the African-American community, the reason there are concerns is because the predatory marketing happens specifically in African-American communities. Like right now, I want you to take a moment to think about all of the tobacco signage you see on tobacco retailers, for example, gas stations, when you're driving through an African-American neighborhood. However, if you think about an area like in, for example, Mount Pleasant, you don't see all of those all that signage and stuff. And a lot of times the ads are menthol flavors, which again, I've said it makes it harder for people to quit. Here in the Charleston area, the African-American lung cancer among African Americans is really crazy. And so we're pretty sure that those things are linked. So this has created and is perpetuating health disparities. This is also a social justice issue. So here in the Charleston Tri-County area, the Smoke Free Low Country Coalition has worked with Smoke Free SC around a project called Counter Tools, and we've been doing point of sale research. And more specifically, we've been researching the marketing practices of the tobacco industry. So in Charleston and Charleston County. So 72% of the tobacco retailers have outdoor ads, like I was just talking about. And the other concern is that a lot of time the marketing is towards children. So 41% of the ads at the tobacco retailers in the area are 3 feet within 3 feet of the floor. When that happens, that means they're marketing to children. And throughout the years, Smoke Free Low Country has been doing this work for like maybe 4 or 5 years. And we've been noticing that it's been trending backwards. Like we want the advertising to children to decrease, and it's been increasing over time, we've noticed. Anytime you see tobacco products near things that are enticing to children, like bubble gum, candy, things like that, that's marketing to children. 100% of the retailers in the area are selling menthol. 94% are selling menthol flavors. 94% are selling e-cigarette flavors. 97% are selling flavored cigarillos, little cigars, or blunts. And so with that, that's concerning because again, the youth, e-cigarettes are the thing that youth are doing. They're vaping in classrooms, and it's the flavors that are a concern. 84% of the tobacco retailers within the area are within 500 feet of one another. And so there are clusters that are happening in certain communities. Next slide, please. And so this is an example of what I was talking about. I wish my picture was a little closer for the Circle K, but if you look very closely, you don't see any tobacco ads here. There's an ad about soda, but if you look at the ad, the picture of the African-American neighborhood, you see tobacco ads everywhere. You see one within 3 feet of the floor on the right. You see the cool sign, that's a menthol product. And if you look really closely, there are other ads, tobacco ads there too. Next slide, please. And so this these were taken in Charleston as well. This is predatory marketing towards children. Another thing that Smoke Free Low Country has done is they've even evaluated the amount of signage within 1,000 feet of schools. And that is concerning because the kids are walking home or they're on the bus and they're seeing all these ads. So in the picture on the left, you see the ads are within 3 feet of the floor. A lot of times you see the ads on the trash cans at the gas station and all kinds of other places. And then if you look at the picture on the right, you see Juul. That's an e-cigarette, and it is surrounded by candy, bubblegum, things like that that are enticing the children. So no, it's not a traditional ad. They actually have the actual product right there. Next slide, please. And so health implications. So tobacco use increases the risk of various types of cancers. I have lung highlighted. We all know that smoking and tobacco is tied to lung cancer, but there's also leukemia, bladder, cervical, colorectal, esophageal, kidney, liver, oral, different types of oral cancer, pancreatic cancer, stomach cancer, the list goes on. And then hypertension and heart disease. A lot of times you hear people talking about eating healthy and exercise, but that when it comes to heart disease and hypertension, that's only part of the story. The other part of the story is increased risk due to tobacco. It can cause infertility, death due to COPD, especially for people that started smoking in their teenage years. And that is of concern. Marketing happens to a lot to children because the tobacco industry has to replace the customers that they kill. And so they hook kids when they're young so that they'll have a lifetime customer. A lot of people don't know that tobacco use increases the risk of type 2 diabetes. And in addition to oral cancer, you also have gum disease, loss of teeth. For women that are pregnant and are around second or third hand smoke, they have, or if they smoke during their pregnancy, they have increased risk of having tissue damage to the brain and the lungs of their unborn child. And you also increase the risk of cleft palate. And then for people that take certain medication, they have a list of side effects. Sometimes the risk is increased of those side effects if you smoke or use tobacco products. Next slide, please. So this is a quote from my public health hero, Dr. Marvella Ford, who works at MUSC, and she's been doing a lot of research around different types of cancers, especially lung cancer. And so I took this quote from one of her articles. Lung cancer continues to be one of the leading causes of illness and death among racially and ethnically diverse populations in the United States, especially for the Black population. Lung cancer is the second most common cancer, but is the leading cause of cancer death in both Black and white men and women. From 2012 to 2017, the lung cancer incidence rate was 18% higher in Black men than white men. Black individuals with lung cancer continue to have more advanced stages of disease at diagnosis and lower survival rates compared with white individuals. So that kind of gives you a picture of the health implications due to tobacco use. And again, menthol makes it harder for people to quit. So next slide, please. So we are here to help. We've been out in the community talking about menthol for people that smoke tobacco and letting them know that you can keep trying. We try to direct people to the quit line, let them know that there's nicotine replacement therapy, but there is a problem in the community when it comes to addiction. And then we're trying to educate the community so that they can hopefully try not to start smoking in the first place. Next slide, please. And so this is my contact information. You can reach me through Breathe Easy by emailing breatheeasytricounty@gmail.com. And then we also have our website, breatheeasytricounty.org. And then y'all can call or text me if you ever need me. Thank you. And so instead of questions right now, if you have any, I would like to introduce Dr. Philip Gardner from the African American Tobacco Control Leadership Council.
Thank you, Lysandra, and excellent presentation. And thank the Wellness Committee for having us this morning. I did have an opportunity to send you a letter about this issue of menthol in the African American community. Be appraised that the African American Tobacco Control Leadership Council has been pushing this fight around the country in different states and at the national level. In fact, why the Food and Drug Administration has finally taken this up, because my organization sued them a few years ago, pushing them to actually deal with this issue. I thought I'd highlight a couple of things. I thought Lysandra kind of drove it home in terms of the marketing. I don't think we need to say clearly there's disproportionate marketing going on. But a lot of times people ask, so why menthol? Now, let me try and make this point as clear as I can do it. Menthol is the ultimate candy flavor. It allows the poison to go down easier. Why they put it in cigarettes is that menthol is an anesthetic. It has a numbing and cooling effect. It leads to deeper inhalation. Deeper you inhale, the more nicotine and toxins that you take in. The more nicotine and toxins that you take in, the more addicted you become. The more addicted you become, the harder it is to quit. When we say that it makes you more addicted, menthol compared to non-menthol cigarettes creates what we say from a scientific level, more nicotine receptors in the brain. They need to be filled more often. We actually have data that supports this. This is why menthol smokers are harder to quit. They have more nicotine receptors that are filled. Another thing that we should say about menthol, allows what we call greater cell permeability, meaning that if there's menthol in the smoke, it crosses the cell membrane much more effectively. This is why there's greater rates of disease in people who smoke menthol cigarettes. And unfortunately, African Americans disproportionately smoke this product. This is not only true of when you smoke it, if you chew tobacco that has menthol in it, it crosses the gum barrier much more effectively than if it doesn't have menthol in it. So this is not a minor matter. This has been going on for some 50 years, the predatory marketing of this. And our organization, I want to thank Lysandra and the group here for inviting us in. This is not only a public health issue, it's a social justice issue. It's an issue where the most poorly equipped group of people as it relates to health, African Americans, are being preyed upon by a major conglomerate, in this case, the tobacco industry. So I strongly encourage you to consider what's going on around the country of ending the sale of menthol cigarettes and all flavored tobacco products in Charleston. And why don't I just stop there and we can take any questions that folks have.
Yeah, and I also wanted to add that if you all would like more information, Breathe Easy Tri-County and the National Council of Negro Women Bethune-Leonard Section want to extend an invitation to you to join us on October the 20th, and you'll have an opportunity to ask more questions and we'll have more information for you. But we have a formal invitation coming with more details about that. Okay, I'm done.
Dr. Morgan, that's a virtual meeting or that's an in-person meeting?
In person, it's the reception. We want y'all to get all dressed up and come have fun with us.
Very good. All right. Any questions, Paul?
Chandra, and Dr. Phil, what would be your ask of the city? What specifically can the city do to help in this situation?
Dr. Phil, you want to take that?
Well, certainly, we've been doing this around the country. What specifically is being asked? It's that the city, in the sale of menthol cigarettes and all flavored tobacco products within Charleston, what's taken place, and without exceptions. I mean, there's been all these discussions about, well, we should leave this store open. Maybe we should just do it for adults. Let me tell you how bad turned out. In Ireland, there was a bill passed in 2017 that essentially got rid of flavors in menthol, except at smoke shops. There were only 5 to 8 smoke shops in Oakland in 2017. By 2020, that had increased to 55. So let's not set ourselves up in Charleston and have carve-outs that will lead to even greater tobacco consumption and even greater flavor consumption. All products, all locations, at all times. So I think that's what Charleston can do. Be appraised that this is being discussed not being discussed, it's on the agenda in Columbus, Ohio, in Westchester County in New York, in Stockton, California, in Atlanta, Georgia. These discussions are going on right now with city council members. Some people on this call, Sandra particularly, was at a conference this past week in Washington, D.C., where we met all these that are work around the ball. It's the only flavor left on the market since 2009. That's unfortunate. It was actually conscious on the part of the tobacco industry to force the FDA to say, if you're going to regulate cigarettes and get rid of flavors, keep menthol. It's an abomination. So yes, Paul, what they can do is they can end the sale of menthol cigarettes in Charleston and all other flavored tobacco products.
Kevin, if I could follow up on asking that question. I know that 2 years ago, we had Kenneth Ray and Beth Johnson at one of our meetings, and we were talking about preemption going on at the House and the Senate and the State House. And the concern there was preemption was they were trying to make it only where it could be mandated from the state level and took it away from the local levels. So are y'all suggesting with this area that we need an ordinance, or you're looking for something to try to help? What specifically, Dr. Ray, you said in sales, but what specifically would that entail?
Well, you raise a good point. What is taking place around the country is that ordinances have been developed that actually detail specifically what products would be removed, how soon they would be removed. And let's make one point clear that sometimes gets lost in this whole debate. This is not about penalizing individual possession, use, or purchase. This is not about having police stopping young men and women for possession of a menthol cigarette. This is about putting in place laws and regulations that prohibits the sale of it, the retail sale of it, and not just the clerk being targeted. It should be the retail owner that is being targeted. So yeah, there needs to be what we generally call, tobacco retail licensing ordinance that have passed around the country. Excuse my ignorance, I'm not clear if there is such an ordinance in Charleston, but clearly ordinances in the country take all these matters into consideration. This is a good question, Paul, by the way. This isn't a minor issue. There's actually model legislation that we can share with you that's developed by the Public Health Law Center in Minnesota that actually goes over this in detail and what other cities have done and what Charleston could do.
Okay, any other questions or comments for Dr. Gardner or Dr. Morgan? Mayor Tecklenburg.
Thank you, council member, and sorry I was a few minutes late. Dr. Gardner, thank you for that update. And if you would share that information with us, that would be most helpful. My belief is that we just follow state law here and don't have specific city ordinances that conflict in any way with state law. And so sometimes that can be, sometimes we want to be a little more wellness oriented or careful than what the state will allow. But anyway, I'd be happy to check into that. Send us what those other cities are doing, and let's I'll get the legal department to check it out. Thank you for bringing that up.
We will certainly do that. I know, Lysandra, do you already have copies of that? Or would you like me to send it to, I'll send it to you, or how would you like to proceed?
If you'd send it to Paul, that'd be great. He'll get it.
Okay.
To the
Yeah, we'll get it to Paul. And
Yeah.
I just would like to thank you all again for having us. Like Dr. Gardner said, we were at a national conference and everybody is looking at the work that Breathe Easy has done, and they're excited to see what Charleston's going to do. So thank y'all for having us.
All right,
Thank you.
Mayor, you brought up an excellent point. Sometimes if you're going to deal with health disparities, sometimes it has to be, and oftentimes it has to be dealt with at the local level. If we're going to take care of ourselves, then we have to actually look out for ourselves. One size doesn't fit all. A blanket law doesn't necessarily take care of the poor. I appreciate, and Lysandra, excellent presentation. We really need to think about doing it in Charleston and not wait on. It's similar. We have a little chant. We can't wait on the FDA. People says, well, the FDA is taking this up right now. It's taken 13 years for the FDA to get on the issue about menthol. It'll take another 2 to 3 years for them to produce a rule. And when they produce a rule, the tobacco industry will sue. So we can't wait on the FDA. We can't wait on the state. Let's move forward with Charleston.
Well, thank you. We will certainly look at that, and we've done that before. But in South Carolina, generally speaking, the legislature they like to tell you what to do, but they don't like to give local authorities the authority to tell people what to do. It's the way it kind of works. All right. Thank you.
Paul, go ahead.
Kevin, one more just statement. I don't know if everybody read the paper yesterday, and the headline on the front page in the bottom section said vape usage soars among Charleston teenagers, and it was talking about the school districts. And whatever we can do, that your Lysandra's comments about the 1,000 foot around the school district, and what school children are seeing as they ride into schools and all, and where they're waiting at bus stops. Those are key areas, and I don't know if we have any ways to deal with it, but I know we got to be partnering with our school district and all to work with what we can do to try to get that message out to our children as well too.
Yeah, I'm a former DHECer, and when I worked for a DHEC, I worked for the community systems team, and people often, I think I remember Dr. Katie reaching out about how bad like the vaping is in schools. The children are actually vaping in classrooms. So schools are wondering like if they can have equipment to detect the vaping. And I asked my sons, I have a 12 and a 13-year-old, asked them about their friends vaping, and they're like, Mom, who doesn't vape? They feel like they're the odd ones out because they don't. So that's just how bad it is these days in the school. So I do agree, we need to partner with the school districts as well.
All right. Well, we look forward to getting some more information from you, and this committee will certainly be discussing this in in our future meetings and everything. We'll spend some time on this. So thank you very much. Anybody else? All right. Well, thank you again. Thank you very much. I did want to mention that Nick Osborne, Lisa Burbage, and Carolyn Murray, I meant to mention this at the beginning, all called and sent their apologies, and that they weren't able to make it today, but they each had a conflict. So did want to let you know that they all called and said, please apologize to the group that we weren't able to make it, but they had a conflict. So, we'll on to our community health update now with Dr. Richardson, and I think she's going to also introduce Shanna Hasty as well. So Dr. Richardson.
Thank you. And yes, I am. Shauna Hasty is joining us from the prevention team. She is a preventive health social worker here in a low country region based out of our Northwoods Health Clinic, soon to be moving to the Charleston County Health Department on Rivers Avenue. And Shauna is going to be representing the City of Charleston Fast Track Cities Initiative in Seville, Spain, later this month. We are very excited about that. And Paul and I asked her to come to give the presentation that she will be giving in Seville, so that we can all give her any feedback we might have prior to that presentation, but also to see the good work that has been happening around the Fast Track Cities Initiative to end the HIV epidemic here in the Charleston area. So welcome, Shauna, and the floor is yours.
Well, good morning, everyone. It's such a pleasure to be here, and just a great opportunity to share some of the work that we've done in Charleston with a larger audience in Spain. So we're going to kind of get into it, and you all are going to kind of help me along the way. So if there's anything that I need to include or add, feel free to let me know that, and especially if you have questions at the end. As Dr. Richardson mentioned, I will be headed to Seville Sunday to prepare for the presentation for Fast Track Cities. They really want to look at the work that we have done in the Charleston area with the Future is Your You campaign in Charleston. Next slide, please. So before we really talk about the Future is You, we want to kind of see where we were as it relates to Charleston, South Carolina. And these are the target rates that they have for Charleston, the 95, 95, 95. And I know many of you all are familiar with Fast Track Cities, but I kind of want to reiterate what that is. It's basically, we want individuals who to know their status. So 95% of individuals know their status, 95% of those individuals who are aware of their status to be on antiretroviral medication, and to have 95% of individuals virally suppressed. So as you can look at the numbers on the screen, thank you, Paul. This is looking at where we are. So we're looking at, we have 85% of individuals diagnosed, we have 88% of individuals suppressed, but the middle number is where we really want to put most of our focus, because we want those individuals to have effective care for those who know their diagnosis. Next slide. And when we look at this map, this is a map of individuals who are out of care in South Carolina. This is a very large map of South Carolina, but we focus on, in the low country, 11 counties, but in the Tri-County area, we are looking at the Berkeley, Charleston, and Dorchester counties. In the map is showing that in the Berkeley County, we have 134 individuals who are out of care. In the Charleston, I'm trying to follow the arrows with you, Paul. In the Charleston area, we have the 566 individuals out of care, and in Dorchester, we have 119 individuals out of care. We're still looking at, and when we think of individuals out of care, those are individuals who may not be receiving any antiretroviral, I'll say, care. We look at our population that works specifically with STDs, HIV, and Hep C. Individuals may be moving out of the area, and we may not have that information as well. So that's some of the numbers that we're looking at thus far. This is the latest map that we have of April 2022. We try to get maps on a quarterly basis. It can be even sooner, but this is the most recent up-to-date map that we have for the Low Country. Next slide, please. So we're looking at where the need is, right? And we understand that in anything focused on health, nothing is monolithic. We need a team to make things happen. And it's very much a collaborative effort. For those who are aware of Shape Tri-County, it's definitely a partnership in the Low Country of all of our partners who feel like sexual health should be a part of our education, but a part of how we work with populations. Ryan White Wellness Center has done a lot of work with us in making sure we can do some of the campaigns that we've done thus far. We have DHEC, we have MUSC, but that does not negate, especially the city of Charleston being a part of that as well. Next slide, please. So we wanted to look at the U equals U, meaning undetectable and untransmittable. In March 2nd, 2021, Shape Tri-County, we joined over 1,000 organizations based throughout 120 countries in signing on the U equals U campaign. And it basically means that living with HIV plus effective treatment will equal becoming undetectable. As you can, I want you all to kind of look at the U equals U signage that was created by artists both in Charleston and Columbia area. And we want to make sure we can talk about the fact that there are individuals who we want to use that signage in many of the outreach that we do. In World AIDS Day in Charleston, the signage was used at the World AIDS Day event. And then of course, in 2021, with City of Charleston and with Mr. Mayor, our Mayor Trent Tecklenburg, we also had the U equals U signage behind at City Hall. Next slide. So U equals U was really the beginning stages of how we really conceptualize the future is you. Next slide. We wanted to think about, as we brainstorm about a concept of the future is you, 4 different aspects. We wanted to remind people that HIV is still a serious health issue in our community, reduce the stigma around HIV by normalizing the conversation. We want this to be a conversation where you can have it with your friends over coffee or what have you, to have a very relaxed conversation about sexual health. Educate people about being undetectable and untransmittable, and empower people to take charge of their health and getting tested. Next slide. So we actually received funding we'll say a 3-year strategy of funding focused on how do we really incorporate the U equals U in our messaging to educate our state. In 2020, we received a PSA grant awarded $2,000. And it was eligible for any of the SHAPE initiatives throughout the region. We have 4, the Midlands, Upstate, PD, and of course, our Low Country area. This, the grant funding was to increase awareness and provide education regarding STIs, HIV, PrEP, or co-infections at the regional level. At the end of our initiatives, we were tasked at making sure that we provide post data regarding the intervention that we did in our respective areas, regions. And I always want to thank Ryan White Wellness Center, because not only did we received $2,000 of funding, but they utilized some of their marketing plus some other dollars to lead to the Future Is You website that we also have, that I'll be showing you a little later on this slide. In 2021, we received an additional $3,000 for PSA Grant Award to expand on the Future Is You with a digital billboard. So the first year we worked on creating the website, and the second one, we wanted to make sure that the information on that website was visible to our community. We initiate the PSA campaign, and I'll say the criteria was we needed to initiate the PSA campaign by December 31st, 2021. And as of this year, we still have, there's an additional $3,000 pending for additional funding to expand on the billboard and more of our initiatives focus. We think this time around, we wanted to really highlight the Future is You on social media platforms, and then specifically Instagram is where we would like to focus our funds and our attention. Now with the Future is You, we wanted to really highlight the specifics. When we think about the CDC and different aspects, we wanted our target audience to be individuals, adults 18 plus in the Tri-County area, which was Berkeley, Dorchester, and Charleston. And although the LGBTQIA communities really are a part of our key focus in many of our initiatives, we wanted to this be inclusive for all races and all genders and individuals, that they are a part of this as a part of the solution as well. Next slide, please. So here we are at the Future is You. It was a collaborative effort developed by community of partners to address the stigma of STIs, HIV, and to promote the STI HIV awareness and prevention. Paul, if you can do me the honors, could you click on the futureisyou.org? So I'm going to take us to the website if possible.
It didn't let me, but I will pull it up on the side and bring it back out.
Okay, and you know, for if you want to do that, that's fine. But for time, we can keep going, and we can share that the actual website with the group, because you know I'm very mindful of everybody's time and energy.
I accidentally cut the PowerPoint off. I'll be right back with it.
Okay. And so the benefits of the Future is You, while we kind of get started, is the fact that this was, having this website was actually a wonderful opportunity so we can really connect with our partners. When we're looking at sexual health, a lot of times that focus is really on, blood pressure. As we mentioned before, we may be talking about cigarettes and other aspects, but having the opportunity to incorporate sexual health in our health as a whole really made it possible for us. And I think, Dr. Richardson, did you put the website in the chat? I saw that.
I put the website in the chat, so anyone who would like to go can go themselves and
yes,
and see it.
Thank you so much.
Sure.
Are we okay? So basically, this was a lot of the signage that individuals see. We're really focusing on this conversation on the billboards that individuals were able to see in some of our major highways. We basically had an 80s theme. So we wanted everyone to know that it's not like the 80s. When individuals heard about HIV/AIDS, it definitely was a death sentence to many individuals. And understanding now, we're at a place that with being on medication, with the amount of support you have in your medical settings, that this is a way that individuals can become undetectable and suppressed. So we have a lot of funky outfits. Some of you all may have had that windbreaker at the top right. I wish I still had mine, but I do not. But we wanted to really keep it light and fun. And like I said, this is also a conversation piece that we could really talk about. Next slide, please. So as individuals, we're driving down many of our highways. So if you're driving down 26, you may have seen some of our digital signage. So it was a digital billboard that we really wanted to help expand the messaging. We utilized some of the marketing company in the Charleston area, Adams Outdoor, to help really bring our ideas in our head to the forefront and making the digital billboard campaign. We wanted to also utilize the fact that we started our digital platform December 6th to February 27, 2022, because we wanted individuals to, we know those are high times for, company, I won't say company, but holidays. So that was a time where we could feel that individuals would be up and down the highways, and so it could be very visible. Based on conversations with Adams Outdoor, we had over nearly 2.5 million impressions. So that was 2.5 individuals who were able to view the actual digital billboard that you see on the screen right now. Next slide, please. So as we thought it was definitely a wonderful opportunity to have the digital billboard. There is still work that we need to kind of look to do. And so the next steps that we want to really focus on is how do we increase the reach in rural areas? And also how can we tap into the social media and dating apps? And I think as we move forward in the 2022 area and moving forward, how can we include the Instagram and see how that can be a definitely effective way to reach mass audiences? And we also know that, of course, even though it was on a highway or billboard, it may not have been the safest way to really read a whole sign of the billboard, but this is definitely an avenue where people could grab individuals' attention. And many of you all know none of this is possible without additional funding. The more funding we can do, the more focus we can do on really maybe focusing on targeted population, but really looking at the state as a whole, especially Charleston. How can we improve the resources in our area? Next slide. Well, that completes the presentation. If you have any more additional questions or comments, feel free to reach out to myself or Dr. Richardson for more information on the Future Is You and just more work that we are doing in the state of Charleston. Well, I'll say Charleston, but we're really working a lot. So thank you all. Do you have any questions?
Thank you, Shauna. Any questions? Thank you. Mayor Tecklenburg.
Oh, me, I always got a question. Shanna, thank you for your good work. Going back to the goal that we're have the lowest rating on, the 66%, isn't that a matter of converting those 800 or 900 or so individuals in the Tri-County area to actually engaging in some kind of treatment or preventive care?
It is. It absolutely is. It's one of being able to engage. And we understand when individuals are dealing with healthcare, that's definitely a very sensitive conversation for folks to really have, especially when we're dealing with the sexual health. We want to make sure that there are ways that they know that they can actually come to us, even just simply, even in DHEC, many individuals are not aware that there are social workers available that focus on sexual health. So how can we engage those groups?
Yeah, so is it more a direct outreach rather than a mass marketing kind of campaign that would impact that number?
I would say both. What, Dr. Richardson, what about yourself?
I was going to say the same thing, that I think it's really both, not either or, because we have to address stigma. We believe that so many people are not in care because of the stigma around HIV. So that's really been a general marketing campaign. But then there's also direct outreach, and we have a data to care program, as well as Shauna and our other support staff in the preventive health program that work with individuals living with HIV who may have never linked to care originally, or may have linked but then fallen out of care and need to be relinked to care. So we're certainly working on those individuals as best we can to support their other needs and ensure that that they find the treatment location that best suits what they're looking for. But also we want to continue to address the stigma that we see, particularly in the South. around those living with HIV and the U equals U, and saying, you know, people living with HIV can really live normal lives now, and they are not the risk to others in spreading HIV. That is true for those not on care or that don't know they're living with HIV, but with effective care, they really can then be
Untransmittable.
right, exactly, untransmittable, and be able to live healthy lives, healthy relationships, and really help us get to that ending the epidemic.
Right.
95, 95, 95 that we're working towards.
Is it my bad memory, or when we signed the pledge initially, wasn't it 90%? Did they up it to 95, or was it
They
always
did.
90?
Yes, they have increased it because
Yeah.
some
They're
cities have
moving the goalpost on us. We're getting close on 2 of them, and they moved it on us.
That's right. I mean, in part because we have the tools.
Yeah.
You know, not only do we have effective treatment, but now we also have PrEP, or pre-exposure prophylaxis. That is a very effective preventive regimen for those who are not currently living with HIV, but may be at risk for contracting it. So that in combination of some cities reaching that 90-90-90 led them to increase the numbers.
I got you. All right. Well, thank y'all for your good work on this. It seems like we're making progress. God bless.
Dr. Richardson, did you want to mention the Nailed It event that we recently had as well?
Yes, if you could briefly mention that, that would be great.
Absolutely. And so, like I said, we use every opportunity to kind of connect with the audiences. So we have fast track chats that we have started. And we recently had our first one on last week at the College of Charleston. So it had, and yours truly, Paul Wieters, and it was Miss Lauren. Were you there as well? Absolutely. So we had the college students to really share their experiences as regards to the conversations around sexual health and also curriculum. And what we gauge from that conversation is that students would like to be more aware of where they can receive testing around sexual health outside of the school system, but also how can they incorporate sexual health as a part of the curriculum being introduced to the school system. And so, you know, Paul was there, Lauren was there as well. Those are other opportunities where we can share U equals U as far as what we're doing with the Future is You and the website and other events moving forward.
Thank you.
Thanks for joining us, Shauna. Paul, would you like to add anything with your from your experience being there? And thank you for coming.
I guess mine was a little bit of eye opener of how much the kids, the college students that spoke of their need to want to be a part of the solution of communicating and trying to get, trying to help students when they're coming into college to understand about how to talk about consensual and how to stop sexual abuse and how to just to equip freshmen coming in with their eyes wide open all of a sudden about how to deal with issues that will be in front of them. And I thought that was important to understand, because they were saying how they're not getting it in high school. It's sort of like almost like a joke in some areas and from where they were coming, but how the more that they had opportunities to have conversation, at least people would, the students would have a little bit better feel of the sexual education that they had. So I thought that was an eye opener, and I look forward to. It was great because DHEC had 4 or 5 community health counselors there to figure out how they could be integrated into those discussions. And Mayor, this was part of the SHAPES program to start these chat talks in different communities throughout the Tri-County area to make sure that the different groups are at least understand there are plenty of resources in the community for them to reach out to We just need to know, they need to have a friendly face in front of them to know how to reach that. And they were appreciative that the city was there to listening in on it. So
Great, thank you.
Absolutely. I know we're running out of time, so I think my message for the rest of the community health update is just the importance of vaccinations. We are starting to see flu rates going up. Georgia in particular has seen increased flu rates already, particularly in children and young people. Flu vaccines are available, both the flu mist and the injection. This year, they are available at DHEC. They will be available soon in our school systems through the school-located vaccine clinics. Many of our grocery stores and pharmacies, as well as our providers' offices, do have them available. This is not the year to delay your flu vaccine to November or December. This is the time to get that. We could see a bad season because we had less flu in the past couple of years with the preventive measures around COVID. So get your flu vaccine. Likewise, please get your bivalent COVID vaccine booster. That is now available. We are still seeing decreases in cases and hospitalizations here in South Carolina and across most of the United States, but Europe is beginning to see an increase in cases and hospitalizations. And over these past couple of years, we usually have followed Europe by a month or two. And so we could see a dicey winter. We have good evidence that's increasingly coming out based on looking at those who've gotten the booster, that it is effective, that it is safe. I've gotten my booster, my kids have gotten their boosters. The only recommendations are to wait 3 months after an infection or 2 months after a previous booster. And we hope that it will be now a yearly booster going forward. So this should be the last one for a while. And then finally, with monkeypox, we still are offering those vaccines in health departments, as well as some of our community providers, including Fetter and the Ryan White Wellness Center, as well as Palmetto Community Care. So for those at risk of monkeypox, please reach out and get those effective and safe vaccines. I'll stop there and happy taking questions, but also allow others to put in any final words.
Paul?
Two things. One, to remind everybody, you mentioned vaccinations. Flu shots are important, and they're starting to come out now. So that's around. But Katie, do you want to briefly say anything about the national dialogue on intersection of racism and HIV as a public health crisis that the Charleston community has been asked to be a part of?
Yes, thank you, Paul. So also as part of our Fast Track Cities Charleston, we have been asked or given the opportunity to have a virtual dialogue on the intersection of racism and HIV here. And I believe the date is, December the 8th. Let me know if that's not correct, Paul. So Paul and I and others involved in SHAPE are beginning to put together lists of those who may serve on some of the panels. I don't have it in front of me, but will revolve around income inequality, housing, behavioral health, those intersections with HIV. And so we may be reaching out to some of you on this call and others on this committee to allow us to have what I hope will be a very engaging dialogue around racism and HIV, and really to start addressing some of those racial inequities that Dr. Morgan spoke of earlier today, and certainly affect so many aspects of health through our social determinants of health. So thank you for reminding me of that, Paul, and more information to come.
And that is December the 8th. We're joining other cities like Denver, Atlanta will be coming up. Boston has been in these discussions. It's been all over the country. These discussions are happening. And yes, they include mental health. They include all the different areas as part of their discussion toward it all. So it'd be interesting who all of our panel that we can find to represent our metro area on it.
And will allow sort of our local concerns to inform a report then, which will really draw on all of these dialogues through the Fast Track Cities initiative. So again, thank you, Mayor Tecklenburg, for joining the Fast Track Cities initiative and supporting our efforts in this area.
Absolutely.
Thank you, Dr. Richardson. And just check with Jennifer Roberts, see if she has community updates she'd like to share.
Thanks. I really don't. You know, we're still here. We're still hiring. But yeah, I don't really have anything today. Thanks for asking.
All right, very good. Anything else under community updates now, Paul?
Jennifer, do you have any updates on the 988, y'all's progress?
Yeah, a little. I mean, we're doing a lot of meeting with 988 advisors and Vibrant and things, but yeah, it's a slow process, but we are, as I think I mentioned, we're leasing part of the building across the street from us, and we have to do a little construction. We're trying to get it open in early 2023, but it probably will be a little later than early 2023, just because even getting work done, architects to do everything takes longer than you want. But yeah, we're trying to get it up as fast as we can, because we do want to support 988 Greenville, who's answering our state's calls, and they're answering about 75% of the calls in the state right now. So that means the other 25% of the calls go somewhere else in the country that don't know our state's resources as well as we do. So obviously, the sooner we can get the second call center for South Carolina up and running, the better off all the people who live here will be, because we all know our resources better than people in California. So, but I'll keep you posted on that.
It also would be helpful if there's any mental health items locally that we can put in our newsletters or other items to just help promote that number, as well as your services. I think the more we can keep mental health in the front of everybody, the more solutions we'll find to help everybody. So especially after the bad weather that's gone through.
Yeah, and we try to advertise that number and mobile crisis number, because if 988, someone calls that line and they need somebody to come out, they still have to pass the call to the mobile crisis call center. So I kind of try to talk about both of them together all the time. So there is still that available statewide, 24 hours a day.
Thank you.
All right. Any other community updates from anyone? It is just a couple minutes after 10, so we did pretty good. I appreciate everybody's time and your expertise, and a lot of good information out of this meeting. And we really, really appreciate it. Your time and your expertise makes the city of Charleston much better, and we appreciate all that you contribute to this. So if there's nothing else, we are adjourned. Thank you.